To start the day off, I am pleased to introduce the well-loved Dr. Barry Simon. Dr. Simon is a psychiatrist and psychoanalyst. He's an assistant professor of psychiatry at the University of Toronto and a consultant for the Leadership Center for Diabetes at Mount Sinai Hospital. His work aims to improve diabetes adherence in people living with diabetes. For the past 2 decades, he has generously shared his work with dietitians, diabetes educators, family doctors, and medical specialists. He teaches effective, motivational, and psychological strategies to improve diabetes adherence through an understanding of the mental challenges of living with a chronic illness. He has developed structured CBT-based programs for the treatment of emotional eating and binge eating disorder. Increasingly, he has been using spiritually based methods in his care for people who struggle with diabetes distress and diabetes adherence. Today, he is sharing with us Heavenly Sweet Talk, the impact of meaning and purpose on diabetes distress.
Thanks, Lisa, for that very warm introduction. And I'm looking forward to participating today in the Diabetes Frontline Forum. My name is Barry Simon. I'm a psychiatrist at Mount Sinai Hospital in the Leadership Sinai Center for Diabetes. And I'm going to be talking today about Heavenly Sweet Talk, the impact of meaning and purpose on diabetes distress. These are my disclosures, but I won't be making any more references to medications today. These are objectives, and it's a lot to do in 20 minutes. We're going to recognize that diabetes distress has specific origins in the brain, and we're going to talk about how the distress of living with a chronic illness can be displayed beautifully through looking at diabetes distress. And I'm going to introduce you, and I mean the word introduce you, to a 4-step process and its potential benefit in improving caregiver um, self-care, their own self-care, as well as diabetes distress management. The work is based upon Viktor Frankl, who wrote Man's Search for Meaning. Viktor Frankl was a psychiatrist, a psychoanalyst who in World War II was imprisoned in a concentration camp, and there noticed that there were people who, despite all of the circumstances they were under, were giving away their last piece of bread or were comforting others despite the impending death that they all were facing. And he had a quote that came out of his experience, which was that everything, can be taken from a human being, but one thing, the last of the human freedoms, to choose one's attitude in any given set of circumstances, to choose one's own way. And in the concentration camp, he found his own way and watched others take care of others, because his commitment began to be to take care of others, to bring his experience to that experience that was as horrific as it was, and take care of others. We've had other experiences in many of our lifetimes, the 9/11, and here's a man clearly in grief around the loss of someone. And we can see that during these moments, we need to have ways of coping that go beyond our typical methods. We live right now in the time of COVID, and people are struggling with, if it's not COVID fatigue, COVID anxiety, or our frontline healthcare workers who are suffering from deep, deep sense of burnout, overwork, and facing death daily. Much of this work that we're going to talk about is the fact that we have this very well-designed brain that in the face of stress, we go on full alert to deal with it. And that comes a lot from the amygdala, which unfortunately is spelt wrong on the slide. But that's the fear circuitry in the brain. And the goal is to calm that down, because so many of our experiences when it comes to the media, different social media ways of receiving information, we're constantly triggered by things that really aren't threatening us, but they begin to feel like they're threatening us. And this fear center is activated by impending threat of danger and harm. That's what we usually call as the lizard brain, or a sense of not fitting in or not measuring up. That's our mammalian brain. We're all mammals and we want to be part of the herd. And as well, beings have this unfortunate or fortunate capability to predict impending suffering. We know that bad things could happen, and we respond to that with fight, flight, and freeze. And this all has a lot to do actually with diabetes distress. So, diabetes distress is defined as a patient's concerns about a disease management, support, emotional burden, and limited access to care that can result in significant distress. And we have the diabetes distress scale as a way of measuring that. So, when you think about diabetes distress, patients are obviously using their lizard brain and thinking about that if I have high A1Cs, bad things are going to happen. And as well, um, they could have a sense of not fitting in because from a young age, if they have type 1 diabetes, they're different than others. And finally, they can look down the road and they're constantly told if they have type 1 diabetes or type 2 diabetes is some future suffering. This was a study that referenced in this slide of how diabetes distress impacts A1C. That the greater someone's diabetes distress on the diabetes distress scale was associated with a higher A1C and a greater percentage of missed insulin boluses. And major depression or depressive symptoms wasn't associated with this missed insulin boluses in this study. There's been studies to try to improve diabetes distress. And it's not going to be surprising, this study done by Fisher and Polanski, names that you're familiar with when it comes to diabetes distress, they did a randomized controlled trial to reduce diabetes distress among adults with type 1 diabetes. They had two interventions. The on track intervention, which looked at emotional regulation based intervention. So they tried to help people cope better with their emotions, which is a lot to do with diabetes stress, and the other, the Know It, where people learned how to problem solve better. And the results weren't really surprising. People who had poor emotional regulation or high diabetes distress benefited most from the on track, the emotional regulation based intervention, while the patients who had effective emotional regulation benefited from the knowledge based one. So, one of the questions I ask myself often is why does diabetes distress lead to non-adherence? Now, we heard about that study that looked at fewer boluses, but why do people do that? And the reason is that human beings have fears about having diabetes. I think I've, let you know that they're fearful of complications. They're fearful of the identity they have that they have diabetes, especially type 2 diabetes, where people say, I'm to blame. With type 1 diabetes that develops at an earlier age, people are struggling with the fact that I'm different, I'm broken, I have this thing that others don't have. And to cope with fears like this at a survival and identity level, people do the same things you do. They avoid, deny, or try to numb themselves from the problem and forget they have diabetes. And if you forget you have diabetes because of your emotional response to having it, that leads you to ignore behavioral care. It makes complete sense from if you think about it, that if I'm trying to avoid all of that emotional pain, I'm going to avoid self-care as well. And for Viktor Frankl, distress, or I would say diabetes distress, any distress in life is suffering without meaning. Suffering without meaning. So the response to this suffering is to accept what's going on. And I'm just going to show you the slides. We really have two choices in life, regardless if we're talking about diabetes or life in general. We can live on fear and societal demands only, which we're just constantly trying to feel safe and wanting to belong, feeling a sense of self, of success, or at least fitting in, or that we actually tap inside to find some sense of purpose of what our life's about, a sense of who we are, and bringing that to the present moment can give us a sense of a higher sense of who we can be and rise us above the diabetes distress. So I've developed this method with Richard Schaub. He's a psychologist in New York City, and it's called the life purpose method. Step one is acknowledging that suffering in life is inevitable and that being present in this moment allows one to make choices, just like Viktor Frankl, to make a choice in this moment despite acknowledging that life is filled with suffering. And if you can then imagine what's central and most important to you, what your purpose in this life is, it gives you a value-based path to rise above fear. And then you need to take action on it. Now, I'm going to stress that purpose isn't just a list of things you want to do. It's a way of being. It's a bringing out of more and more of your essence. If we were having this conversation 200 years ago or 150 years ago, or maybe 100 years ago, we'd say we're talking about soul, being able to tap into who you are. When we're talking about this, I like to think of this as developing what I'm going to call the diabetes distress conversation, which is choosing life in the face of fear. And this is how you could do it in your practice. And I'm going to give you an overview. I'm not going to think in 20 minutes I can let you understand the entire model. Hopefully, we can do some training together in the future. The easiest way to think about it is you offer a patient either the PAID or the DDS, which are both methods of gathering data on a person's level of diabetes distress. And I want to remind you to always keep in mind that diabetes distress can also be the tip of a mental health iceberg, and you need to look for their mental health disorders. So the first step is acknowledging distress as a normal byproduct of living with diabetes. And I say to patients all the time, that many people, and those words minimize shame, many, have distress, frustration, and at times feel overwhelmed by taking care of their diabetes. And it's completely reasonable because diabetes is a very demanding disease. So I would say this to them, and then I say, would you be willing to fill out a questionnaire? And I'll give them the questionnaire, and you want to offer to them and review it in the most empathic way. And I want you to look at the questionnaire and notice these are all meanings that we bring to diabetes. Feeling scared, that's a meaning. Feeling depressed, meaning. Overwhelmed, meaning. Worrying, meaning. That meaning might be triggered by this fear center of the brain, but it is the meaning we're bringing to diabetes in this moment. And when you think of it, all of the diabetes distress statements, feeling angry when you think about living with diabetes, all take place in real life situations. So someone's at a family get together, and their thought might be everyone else can eat what they want, and they feel anger and bodily distress. So this is how you see these statements actually come alive in the moment for patients. And I ask people, do any of the questions on the questionnaire, really attract you? Do they make sense to you? And I explain to them that when you have a chronic illness, you have to take care of it. You can't escape it, which means you're going to feel a lot of distress. And this slowly takes me to step two, which is you need to learn to live with the distress. And I teach people different mindfulness strategies to begin to step back, to not be as caught up in the thoughts they have, like everyone else can eat what they want. So I help them begin to stand back, and we use meditation strategies to do that, or mindfulness strategies. And here's one of the easiest ones. I won't do it with you today, but you can do it while you're listening, even if you want a little break. You would close your eyes or lower your eyes and let the chair support you. And just begin to say to yourself the words, your first name, and the words let go. Your first name, let go. So I would say Barry, let go. And I might say it on the in breath, the out breath, or just not even related to my breath continuously in the background. And that helps to ease the hold of these thoughts on us. And it allows us to less be impacted by the fear center of the brain. This is step one and two, but really they do the same thing. It's a way of disconnecting, but not dissociating, not avoiding the distress within. We're telling people this is a normal response. And the next step is to cultivate purpose so we can actively awaken our deepest desire for a meaningful, fulfilling life as we make diabetes self care choices. So, what does that mean? Um, when a person's making diabetes self-care choices from a fear-based approach, they're ultimately saying some version of I'm broken, I'm burdened, this has got me, I can't escape it. And that's what diabetes distress essentially is. And there's not enough people there to help me. That's why there's a lot of the questions are around their health professionals and their family members. Instead, we want them to be able to disconnect from that only because it's not very helpful, and cultivate more of a sense of what they're doing in this life that's beyond simply having diabetes. And I do that by helping them with developing purpose. And these last slides show you that purpose is an incredibly powerful weapon or method of easing distress in general. I like this slide a lot. It basically, you can read it. What if a new medication came on the market that actually eased the rate of cardiovascular disease, lowered it to a rate of 0.83 in people that had a high sense of this thing we're talking about, lowered overall mortality, decrease the risk of Alzheimer's, change your body to cellular level, and that drug is purpose. This is studies that have shown there's a significant drop in actually all-cause mortality. There's the adjusted relative risk, significant for something that you don't need to swallow, and simply making your life more fulfilling. So there's lots of ways to introduce purpose into people's lives. I use a lot of imagery, a lot of dialogue, but the dialogue's unique in that we're trying to help people remember times of deep purpose in their life. I'll often say very few people want to take medication or want to take care of their diabetes, but many people are willing. There's the key word. That's the choice, back to Viktor Frankl, to take care of it because of something that's really important to them. Can you think of things that are really important to you in your life that matter enough to you? People perhaps or places that you'd be willing to take better care of your diabetes so you could enjoy them, the thing that matters to you, longer by staying healthier. So, next time you feel distressed, stressed, or distressed by your diabetes, begin by acknowledging that it's completely normal to have a thought or feeling like, I hate this. This is ruining my life. No one seems to care enough. And then take a few deep breaths, or you do the letting go, or a number of other strategies I teach people. And then bring to mind that something you're willing to take care of. Um, that's something that you're willing to take care of in your life because it's so important. So you're willing to take care of your diabetes because this thing is so important to you. And my stumbling at that moment was actually because I want to stress a point, that it's not simply children or grandchildren. It's actually something about the person. So it may be often a person might remember that, they've always wanted to learn to play an instrument. And it's not about the instrument, it's about creating something, a sound, being part of a group of people who create sound. It's beyond simply the instrument, which would be a list. It's a way of being that really captures your essence. Um, Another strategy I teach, which we won't be able to go over today, but you can think of, is actually asking people to imagine 5 or 10 years from now and bring that part of you to mind and imagine what it would tell you. This is a wiser, older self advice strategy. And people then bring that strategy to um, the moment of making a decision around their diabetes. Now, to think about what is this thing called purpose, because I want you to at least get a glimpse of the difference. For some people, it might be an image of these are grandparents with their grandchildren, that joyful sense of continuity, something beyond yourself, a second chance to raise a future generation. Um, that could be what it is. It could be something to do with a hobby, but it's an expression of a part of you. So, this grandfather here might say, in his entire life, conveying wisdom to others or thoughtfulness or teaching, um, to be decisive, persistent to others. I could make up a story about this man. Doesn't matter the story I make up, but that story could have a continuity long before he became a grandparent. And this, through his grandchildren, he has another opportunity to express it. That gives you of where I'm really heading with this idea, but you don't need to go all the way down the road to thinking of us as having this essence that we're meant to bring into this life. You can even take it one notch downwards. And I say to patients often, if I feel like that's just going to be the wrong conversation, because I'm trying to meet people where they're at, you can place a picture of your family, your dog, your cottage, and then say every time. So I have patients, it's called the family pill tray. They put all their medication on this image. And if you think about it, now the medication is secondary to the image. So I say to people, a great way to increase your willingness to take care of your insulin is to take a framed picture of your family and use it as your insulin tray, your medication tray, whatever works. And each time you take your insulin or medication, You're reminded of why you don't want to have future problems. No one wants to take insulin or take medication, but taking it regularly will allow you to enjoy your family in the future. So, those cover the first three steps of the life purpose method: acknowledge distress, become mindful, and cultivate purpose. And we now come to the final step with it, which is decisive action from that purposeful way of being during our diabetes self care behaviors. So ultimately, we need to bring this back to patients making the decisions in the moment. So I will then teach people how to use letting go, and they might do the letting go for a minute. So they'll use they'll use cognitive behavioral strategies to recognize a moment when they're at risk of letting the diabetes distress take over. And then they bring to mind either the wise image, they might be the wise mind advice from that strategy I told you about, after they've calmed down and let go and become mindful, or and then they'd return to the diabetes moment and they would be able to see it differently. So after saying Barry let go for a minute or two, I actually have quieted my diabetes distress voice, and inevitably, a healthier, more focused on taking care of myself voice takes over. And that's that when that decisive action takes place that allows people to finally make that healthcare decision. And that's really back to Diabetes Care 101. So, this entire process is a way of taking you into the diabetes distress in the moment of when it's active, becoming mindful to ease the impact of the diabetes distress, which is the feelings, the thoughts that come with it, and even the behavioral inclination to not take care of your diabetes, using letting go strategies or a number of other ones, and then cultivate a sense of purpose, whether it's that wise mind example of person from yourself from 5 years from now or the family pill tray, and using that, then bringing that image to the moment. So I now imagine what's really important to me, why I'm willing to take care of my diabetes, and then making this choice of actually using my Libre, um, using my glucometer, uh, giving the insulin, taking my medication, but from this position of purpose instead. I want to thank you for listening, and I'm waiting to hear the questions you might have. Thanks very much.